Warning now comes from the World Health Organization. After emergency talks, the UN Health Agency says the outbreak is serious enough to trigger its highest level of international alert, while stopping short of the most extreme classification.
The event constitutes a public health emergency of international concern, but does not meet the criteria of pandemic emergency.
The outbreak was first detected in Ituri province in eastern Congo, where health workers are now trying to trace contacts, isolate suspected cases, and stop the virus from spreading further. The strain involved is Bundibugyo, one of the less common forms of Ebola. It's considered slightly less deadly than the better-known DR strain, but it remains a severe disease.
The mortality rate is quite high for Ebola. Across all of the strains, on average, about 50% of people who get the disease are likely to die. We do have some information now about the strain that's spreading. It's the Bundibugyo strain, which has, based on previous data that we've been able to collect in previous outbreaks, it has a slightly lower severity, I think, in the previous outbreaks. Between 30 and 40% of people who contracted the illness died.
For the Democratic Republic of Congo, this is a grimly familiar battle. This is the 17th Ebola outbreak since the virus was first detected there in 1976. But this response is complicated by geography, insecurity, and weak health infrastructure, especially in the east, where access to some affected areas is difficult. And unlike the Zaire strain, there's no approved vaccine or specific treatment for Bundibugyo.
We face significant logistical challenges because unlike the Zaire strain, which we know very well, the Bundibugyo strain has no vaccine and no specific treatment.
Cases have also been reported in neighbouring Uganda among travellers from Congo. The WHO is urging affected countries to activate emergency measures, but it is not recommending border closures or trade restrictions, warning that such measures could push people towards informal crossings and make the outbreak harder to contain.